in Turkey, it was found that the women had their support of the husbands in many cases.
And the other question, and maybe I missed this at the intro, in terms of, you're obviously doing a lot of referral. How much work is done to making sure that the quality of the referral centers is where it needs to be? Because I would imagine a lot of your referrals, you're going to be spinning your wheels if you're referring to them to clinics where services are poor.
Right, and they do know, they have a relationship with all the clinics that they work with, and do check them out. They also get feedback from the women, because they go up and actively follow up with each woman, not only with the woman, but also with the clinic to make sure that the woman went there. So they do get feedback, and there is a loop. I think in Turkey you have advantage of having a certain baseline of service quality, even if it's not perfect, that we don't see in a lot of our places. So
but like in Ghana, so did they invest money and resources in building up the standard of quality?
Right, and we talked to so it's very different. I mean, they're doing sort of one small part of what we do. So I think it's more complex. But one thing they do, I mean, women wanted to see was, public recognition of the places that were user-friendly. So let us know the places that other women liked, which is something we can do at a fairly low cost. But I think to get any kind of, especially if we're talking long-acting methods, and we need to invest in services too. This is just part of the model. Donna? Don't be shy.
Okay, when you talk about political or advocacy, I think this actually requires some advocacy within PSI. One, because if we're talking about quality IPC, we need to help people understand that quality, how do you balance quality with quantity? The people that I see, they're more compelled to reach 50,000 people in a 2-week period as opposed to reaching 20 people, and that's an exaggeration over, more frequently. And the other thing, I think, in terms of advocacy, we don't credit ourselves necessarily for the fact that somebody talked to somebody, which led to our service uptake. We credit whether or not our direct communication to that individual led to our service uptake. And I think if we're talking about the tipping point, we need to be able to give credit to the fact that our intervention, which may have had frequent contact with a smaller cadre of people, led those people to create kind of this ripple effect and take credit for that somehow, whereas our models don't necessarily take credit.
And that's not even something we'd even talked about. I mean, I think that's a fascinating idea. And I mean, is there a research way that, how have you guys given thought to that? Because I so agree that in terms of we need internal advocacy. First of all, I want to understate. I mean, even right now, we're setting targets for IPC for WHP project, and we're looking at numbers of women reached. And there's got to be a better way. We should be looking at the end point. But I mean, that ripple effect is something we're not capturing.
But there's will.
Yeah, I mean, we've been talking to Julie and I and others have been talking to people in Kenya about education through listening and how to measure that, and it's not just measure direct contact, but indirect as well.
Yeah, I mean,
secondary contact, really. So
it would be great, because I think we are just skimming the surface.
But I think the thing to remember is also three things quickly. You said people knocking on their doors asking to talk about family planning, but I think it's important to remember that the first visit is not talking about family planning, it's doing a census.
Yeah.
And so you're just talking to people about their reproductive history and other things that are more neutral. And the second is, I just read a study last week about community health workers in Ethiopia and the importance of non-monetary compensation for keeping them working as opposed to dropping out of the program. And so then when you were talking about literacy, yes, if some of the places where we work, people aren't very literate, offering literacy training to IPC workers in order for them to fill out, this is not an example of non-monetary.
No, this is a great example.
Feedback, or inputs that we can have. But the other thing to remember is that if you pick people from the community, they stay in the community even after the 18 months is over.
Yeah, that's a great point.
So they're not going anywhere.
Yeah, and they've also, and I don't have this information with me, looked at what's happened to the IPC workers after the project ends, and they are, more likely to be employed and more likely to get other jobs. So even just the skills that they learn on this job through literacy training is an incentive. So, great. I'm sorry we kept you guys a couple minutes over. Thank you to Laura for our entertaining.